Hello everyone and welcome back for more human physiology. Let us finish up chapter 20 by talking about fluid exchange dynamics, which requires a little bit of background on blood flow and pressure gradients, which we have obviously discussed in the previous two chapters. So let's go ahead and get into this. So you'll recall that water in the body can be distributed between three different areas. You've got intracellular fluid, which is going to be the cytoplasm of all the cells put together in the body, and that's where you find the majority of all the water in the body. And then you have extracellular fluid, which is going to consist of both the interstitial fluid and the blood plasma. So remember, the interstitial fluid consists of all the fluid that surrounds and bathes the body cells, and then the blood plasma is the extracellular fluid that is contained within blood vessels. So you'll recall that, maybe to your surprise, the water that's in the blood plasma actually makes up a very small proportion of total bodily fluids. So again, most of the water is in the cytoplasm and to a lesser extent the interstitial fluid. You can see in this diagram how some of the dynamics work here. Body water can be exchanged between the three major sources of water, so you can see between cells in the interstitial fluid, between the interstitial fluid and the blood plasma. And then, of course, we have to account for water loss in the form of urination, so we lose about 1 liter of water through urination every day. We lose a little bit through exhaling water vapor through the lungs. We lose a little bit through the sweat glands when we sweat. And then we lose a very minor amount through defecation through the GI tract. So we have to also consider, how do you make up those losses? And of course the answer is water intake, both through the things that we drink and the things that we eat. So once those food and drink materials make their way through the GI tract, specifically the small intestine, we absorb that water into the interstitial fluid directly, where we can distribute it as needed between the three different compartments here. Now, what is actually kind of important here is the fact that there's actually not a whole lot of net movement of fluid between the cells and the interstitial fluid. So, and that's a good thing, because we don't want there to be a lot of movement of water by osmosis, because we saw back in chapter 3 what happens to cells when they either lose a lot of water or gain a lot of water. So in order to maintain water homeostasis in the body, most of the fluid exchange actually occurs between the interstitial fluid and the blood plasma. So that's going to be the focus of our discussion in this video. Okay, so when it comes to the exchange of materials between the blood and the interstitial fluid in the tissues and in the capillary beds, it's not just about exchanging water, obviously. So you have to also consider things like oxygen, food molecules like glucose and fatty acids and amino acids and things like that. So it turns out that when blood flows through a capillary bed, even though the blood flow is going to be slow in the capillary bed, as we discussed in an earlier video, we can't just rely on the simple diffusion of these things from the blood plasma and into the cells. It's not fast enough. Simple diffusion is a very, very slow and fairly random process, even when you have a concentration gradient. So the point here is that even though blood flow is going to slow down when you get to the capillary beds, it's not enough to rely on simple diffusion with concentration gradients. We need some other force to pull molecules from the blood into the interstitial fluid. So this is going to be where we introduce that force, which is called bulk flow. As with anything else that we've discussed in the previous two chapters, this is going to be dependent on pressure gradients. So, as always, the direction of fluid flow is going to be from high pressure to low pressure. So, specifically, one of the major pressures that we need to consider here is what is called the net filtration pressure, and that is going to determine in which direction materials are moving. Does it move from the blood into the interstitial fluid, or from the interstitial fluid into the blood plasma? You might be thinking, well, it has to be from the blood into the interstitial fluid, but in reality, the answer is going to depend on where in the circulation you are actually talking about. So how do you calculate the net filtration pressure? Well, it's actually kind of complicated in the sense that there are four separate pressure forces that we need to consider simultaneously. So I'm not going to ask you to do any of these calculations. I just want you to be aware of what goes into it. So the net filtration pressure is equal to the capillary hydrostatic pressure plus the interstitial fluid colloid osmotic pressure minus the interstitial fluid hydrostatic pressure plus the blood colloid osmotic pressure. Okay, now what the heck does any of that mean, right? So I don't want us to kind of lose the plot here, as it were, so I'm going to simplify it even further than this. So you can think of it as the net filtration pressure is equal to the total pressure inside the blood vessel minus the total pressure outside the vessel. So that's a lot easier to kind of wrap your head around. So you can kind of consider if the pressure is high in the vessel, higher than what is outside the vessel, materials are going to be drawn out of the blood from high to low pressure. If the pressure outside the vessel is higher than what is in the vessel, then materials are going to be drawn from the interstitial fluid to the inside of the vessel. Now, here's what I mean when I say that the answer to the net filtration pressure depends on where in the circulation you are. One of the big things that's going to change when we calculate net filtration pressure is the pressure inside of the blood vessel. You'll recall that as blood moves from arteries to arterioles to capillaries to venules to veins, the pressure continues to decrease. So as blood moves from the arterial side of a capillary bed to the venule side of a capillary bed, the pressure inside the vessel is going to continue to decrease. So what this is going to produce is a situation in which at the high pressure end on the artery side of the capillary bed, the pressure inside the vessel is relatively high, and the net filtration pressure is going to draw materials out of the blood vessel and into the interstitial fluid. On the venule side of the capillary bed, where the pressure is lower, the net filtration pressure is the opposite. The pressure inside the vessel is lower than what's outside, so now materials are going to be reabsorbed back into the blood vessel. And then you can see at some point, kind of in the middle of the capillary bed, we get to the point where there is no net movement because the net filtration pressure equals zero. In other words, the pressure inside the capillary is equal to the pressure outside the capillary. So ultimately what this means for us is that as blood moves through a capillary bed, at the beginning, on the artery side, we draw materials out of the capillary, and then on the venous side, we draw materials back in. Now, we need to ultimately think about this in terms of fluid exchange dynamics, as we're going to see here, but for a moment, let's go ahead and consider things like oxygen, glucose, nutrients, and things like that. Here's the way I like to think about it. If you look on the artery side of the capillary bed where the net filtration brings materials out, think of this as like getting mail. So if you look out your window and you see the mail truck coming, the mail truck's going to come, pull up to your mailbox, and leave a package or leave any letters or junk mail or anything that is bound for your destination, which is where you live. Okay, so that would be dropping things off. Another thing that your letter carrier can do is take any outgoing mail with him or her. So if you're trying to send a package or send a letter or pay a bill, you can leave those things in your mailbox and your letter carrier will take them away. So where am I going with that analogy? Here's what I mean. So as blood moves into the capillary bed from the arterioles, we are going to deliver our nutrients like oxygen and glucose and fatty acids and amino acids and things like that when the net filtration pulls those things out. And then when the net filtration pulls them back in, that's when we're going to give up our waste products. We're going to dump carbon dioxide and urea and any other things that the tissue no longer needs. We're going to take advantage of the net absorption happening here to draw those waste products away. So ultimately, we take advantage of how the net filtration pressure changes to deliver our nutrients and pull away our waste products. Okay, so now let us consider the fluid exchange dynamics here, specifically talking about water. So ultimately, when it comes to water homeostasis, the thing we need to make sure we're always doing, especially here in the capillary beds, is that whatever amount of water we pull out of the capillaries, we need to make sure we put that same amount of water back into the capillaries so we maintain a consistent blood volume. But as it turns out, the rate of filtration out of the arteries is actually greater than the rate of absorption back in the veins. So if this is left unchecked, we're going to end up in a situation in which the net movement of water is into the interstitial fluid, and eventually we're going to drain all the water out of the veins. So how do we fix this? So how do we maintain fluid balance so that we do not eventually dry up the blood vessels? We need to make sure we keep a consistent amount of water in the blood vessels. So how do we do this? So the answer is actually something that we have not really talked about this semester, and it is the lymphatic system. The lymphatic system consists of vessels that do not carry blood, but rather carry what is called lymph fluid, another type of extracellular fluid that we really have not taken the time to appreciate this semester. So a lot of what the lymphatic system does, other than what it does for the immune system, is that it functions to return water back to the veins, water that is absorbed from excess from the interstitial fluid. So when we get to a point where we absorb too much water into the interstitial fluid, the excess gets diverted into the lymphatic system, and the lymphatic system will take charge of returning that excess fluid to the venous system, so that we eventually kind of make things even Steven, so that what excess water we take on the artery side is eventually returned to the veins. Okay, so let's consider a clinical scenario here. So let's talk about edema. Edema is something that literally everyone has experienced, everyone who has had any sort of very minor injury. If you've ever sprained your ankle or twisted your ankle or anything like that, you have experienced edema. Edema is what we kind of colloquially call swelling. If you experience swelling, you are experiencing an abnormal accumulation of interstitial fluid in the tissue. Usually, the cause of this is that an injury damages blood vessels and causes fluids to leak out into the interstitial fluid, causing there to be too much fluid there and the tissue starts to swell, and that is what we call edema. Now, the picture that you're looking at here is obviously an extremely out there and extreme case of edema. This is called elephantiasis. Elephantiasis causes major and extreme edema because mosquito-borne parasites actually get into the lymphatic system and they block the ability of the lymphatic vessels to return that excess fluid to the veins, meaning that we end up in exactly the situation that I indicated here. If we take too much fluid from the arterial side without returning it all to the venous side, you're eventually going to end up with all of your water in the interstitial fluid and none of it in the blood vessels. And that's more or less what you're seeing here. So this person is more than likely experiencing extremely low blood volume because a lot of that fluid is actually in the soft tissue that makes up the leg rather than in the blood vessels. So that's only one kind of extreme case of how edema can be caused. Really, if you consider how we calculate net filtration pressure, edema can be caused by anything that causes the net filtration pressure to shift towards the arterial side, to shift towards filtering fluid out of the blood vessels. So some examples of this: someone with hypertension or chronically high arterial blood pressure, this is going to cause excessive filtration out on the arterial side, and we don't make up the difference on the venous side. So people with hypertension sometimes will experience a little bit of tissue swelling, especially in their extremities. A venous obstruction will cause this same sort of issue. So this isn't even the same thing as the elephantiasis issue, which is what you see in number 3. But if there's something wrong with the ability of the veins to reabsorb water back in, then that can also disrupt this equilibrium and cause there to be too much fluid in the tissues. Number 3, we covered with elephantiasis. And then number 4, the leakage of plasma proteins into the interstitial fluid. And what this does is it raises the interstitial colloid osmotic pressure, and it does so at the expense of the plasma colloid pressure. So ultimately, that means more filtration out and less in. So what in the world are we really talking about with number 4? So this is what we mean when we talk about injury. If you injure soft tissue or you injure your blood vessels, a lot of the proteins inside the blood vessels leak out into the interstitial fluid, raising the osmolarity of the interstitial fluid and causing the surrounding areas to contribute water to make up the difference. Okay, that is going to do it for chapter 20. As always, I thank you for coming and paying attention. Join us next time and we will start our next unit, which is going to start with the respiratory system. And we're going to see a lot of important corollaries with what we have talked about here with cardiovascular, because we are going to be talking about gas exchange and how oxygen gets transported throughout the body. So thanks again, and I will see you next time. So long.